Good afternoon, everyone. My name is Marjorie Ingaldson, and I'm the director of the System-Wide Admission and Discharge Department. But for this week, I've been the team lead for this surgical RPIW number 24, looking at reducing the changeover time in the Pasqua Hospital OR from the time the wheels out of the previous patient to the wheels in of the next patient. We will be presenting here the results of our RPIW, and here is our TAC time to 20 minutes and all of our team members and their portion. This is a photo of our spectacular team. We were 9 members on this team, plus our KPO support, Tamara, and our JBA consultant, Donna. And as you can see, we were dressed up very nicely for Halloween week in our work in the OR. This project form introduces you to what we're doing. We were looking at reducing the changeover from patient wheels out in the OR to the next patient wheeling into the OR. For the theme of the RPIW, the surgical schedule was changed to accommodate more surgeries in a day shift. This RPIW is focused on improving synchronization and signaling for process steps and all staff involved in the OR changeover. The goal is a timely, efficient, and high-quality changeover to ensure a safe environment for our next patient. On this screen, you can see our current state map, and it has very distinct components that I'd like to highlight to you. The first is the start time and end time of our process was the wheels out to wheels in, and as you can see on the bottom, we had a lead time of 22 minutes. So the process that we saw consisted of the patient leaving a room, a call being made to housekeeping for them to come to clean the room. In that time, nurses were still in the room closing the previous case. Once the housekeepers received the call, they would respond to the room and they would spend time cleaning the room. Somewhere in this process, we would have a call for the next patient into the day surgery area to bring and pull the next patient into the OR. So housekeeping was cleaning the room, then nursing would enter the room and do a very specific room setup for the next procedure. The next patient would arrive, and there's a nursing assessment that is done in the hallway, and then the nurse would push the patient into the room. Our TAC time for this process is 16 minutes and 45 seconds. That means every 16 minutes and 45 seconds, we should have a patient leaving an OR, wheeling to recovery.
Good afternoon. My name is Leanna Floric. I work for the Kaizen Promotion Office, and this week I was sub-team lead for this RPIW. This first is just depicting, it's a percent load chart, and it's actually just looking at the case distribution by the OR theaters in terms of the type of surgery, and on the other side, the actual number of surgeries by day of week. I'm going to look a little bit into the pre-RPIW, the target progress report. For the floor, or the space, we looked at the floor and the shelving at the scrub station. That was our 5S project. And we had our baseline of 21 feet and 12, and looking at a 50% reduction. The inventory at the scrub area, we started with a number of items of 29. And the walking distance, we looked at a housekeeper for a turnover, and that was 264. And again, we're looking at a reduction of 50% in the walking distance for a housekeeper for a turnover. Part traveled, we looked at the dirty case cart, and that was from the case cart from the OR theater to the cargo master. As Marjorie mentioned, our lead time is 22 minutes, and we're looking for a reduction of 50% to 11. And again, that was from patient wheels out of the OR to the next case, the wheels in. We had 3 different quality defects that we looked at. One was regarding hand hygiene, and the other one was looking at the disinfectant time that our housekeepers with cleaning the OR table and the other surfaces, and you'll hear it be referred to as kill time, and that's the disinfectant time. And 100% of the time we were not meeting the hand hygiene and the kill time. And the third one was the number of linen bags that were over 20 pounds, and we had a defect rate of 45%. And again, we're looking at 0 defect as our post target. Productivity, we looked at, it's 0.6, and that means that the 0.6 of a changeover per minute. And our 5S, the scrub station, baseline, our score is 1.3. And setup is 17 minutes and 33 seconds, and that's which is wheels out to our green signal that we put in place, indicating that the room is ready. Cycle time, we looked at nurse closing case, room cleaning, and nurse next case setup. Current capacity, we have the current capacity to turn over 23.6 in one day shift. This standard work combination sheet just looks at the three different components: housekeeping component, nursing component, and the patient component. And again, those are the cycle times including waste. And as you can see, housekeeping, their time component, their cycle time is the longest.
Good afternoon. My name is Kathy Bradford. This is my second RPIW as a patient volunteer, and it's been very fulfilling. As mentioned, the pre-RPIW, the time between patient out and the next patient in was 22 minutes. The chart you see here is 21:38, but the most reoccurring was 22. It was obvious that the housekeeping tasks take the longer time, so load leveling seemed to be one of the better ideas to follow, so that there would be more evening out between the OR nurses and the housekeeping. And the leveling between those teams would reduce the total time. Nursing staff now collects the dirty linen to be sure there are no biohazards, and they close the linen bags. The second was full disinfecting time was not being allowed, and that's 5 minutes. And the linen was being applied too soon. So what we're doing now is we're setting an egg timer for 5 minutes. And as soon as the bed is disinfected, then the linen can be put on.
Good afternoon. My name is Jeanette Marshall-Dawn. I'm the clinical nurse educator for the Pasqua operating room. And further to some of the pre-Kaizen work that we did, a problem that was noticed was a lot of the nursing staff were coming into the room and rearranging furniture, tables, and whatnot in the room because housekeeping had left it in a disarray. Now, to address this problem, we decided to make visual signals for the housekeeping staff. So what we did, we made standard setups for each different theater. So as you can see in the room there, everything has its place. So as a quick visual for housekeeping to look up a quick reference as they're cleaning the theater to replace the equipment where it goes. Another challenge that we noticed during pre-Kaizen work as well was not knowing at what time to call for the patient. So we were seeing patients coming in at various times, either way too early and leaving the patient unattended in the hallway, or late, and then room was left waiting for the patient to be ready. Now, to address these issues, several factors came into play. The first being the confusion for the nurse as to which number to call, day surgery or DAS. So what we did for that, we printed out, laminated, and posted the numbers by the telephones in each theater. As well, another thing that came into play is nurses didn't know when the room was quite ready. So what we did is we made up dots by the door for housekeeping to switch over. The green dot would mean the room is ready, and a black dot would mean the room is not quite ready yet, so just to hang on, not to come into the room. Another thing was, where am I here? Right, time definer to call for the next patient. We define that time to be once the anesthetic machine has been cleaned. So as soon as the nurse is done cleaning the anesthetic machine, they're to call for the next patient. And we're finding that now the patient is arriving more or less at the appropriate time. Now, post-Kaizen observations, some of the implementations, we saw the numbers drop quite a bit. Beforehand, our lead time was 22 minutes, and our post-Kaizen time came down to 16 minutes and 15 seconds. This obs sheet was just capturing one observation that we did at 18 minutes, 16 seconds, but the The most recurring time was 16 minutes and 15 seconds, which is a reduction in time of 5 minutes and 45 seconds.
Hi, my name is Jeff. I'm a patient volunteer with RPIW 24. Our team analyzed the walking paths, total steps, and total feet of housekeeper 1. That would be the first one to enter. And housekeeper 2, of course, the second one. We heard concerns from the nursing staff that they were held up in the beginning of their setup. We also heard and observed that in many cases there was only one housekeeper for the first 5 to 6 minutes. The idea we came up with was to effectively introduce defined tasks and duties for both housekeeper 1 and 2. For example, one of them was to, the first housekeeper to be finished would start doing the floor mopping. You'll notice after looking at the pre and post Kaizen diagrams, there are more efficient and effective movements around the room, less crossovers, and less confusion. If a third housekeeper did arrive, they automatically were responsible for the garbage and taking out the dirty case cart. There was a total of 528 steps for 2 housekeepers pre-Kaizen and 420 steps post-Kaizen, a 20% decrease.
Good afternoon, everyone. My name is Roberto Ettrick, and I'm VP of Integrated Health Services from Sunrise Health Region, and I'm a participant this week, and I'd like to thank Regina Qu'Appelle Health Region and this team for making me feel welcome. 3 defects were identified for this RPIW: hand hygiene, the linen bags over 20 pounds, and the kill time for disinfection. For hand hygiene, during the week, the staff are reminded when to wash their hands and the proper technique. Ongoing education will take place, and posters have been posted throughout the department. For the linen bags, at times they were over 20 pounds, so the linen carts have now been marked. There's a red mark that indicates 20 pounds when the linen is dry, and a yellow mark when the linen is wet for the 20 pounds to ensure that it's safe for staff to be moving those weights of the linen carts. The kill time, in order to ensure proper disinfection, as Kathy said, an egg timer has been used to ensure the bed is properly disinfected before putting the linen on. The next slide shows a percent load chart, and as you can see, the tack time is 16 minutes and 45 seconds. By looking at the bar graph, you can tell that we needed to work on leveling the load. The first bar shows the nursing, whether it's 1 or 2 of them, closing the case. The second bar is a big portion of housekeeping, 1 to 4 housekeepers, and it took 16 minutes and 23 seconds. Walking to the room and also cleaning the room was included in that. The next was the nursing staff, in-room setup, and also there's an external setup in the core area, as well as wait time for the room to be ready. And the final portion was the patient checklist, so we know we had some work to do on that area. The next idea sheet shows that there was no specific signal or time when to call the patient. The patient was arriving too early, so we needed to develop a system so the nurses knew when to call for the patient, and that was when the anesthetic machine is clean. So now you can see that it's perfect timing, they're ready, the nurse is greeting the patient, and it's running much more smoothly. We created several standard work and work standards throughout this week. A couple of them that I'll mention is the OR cleaning standard work for the housekeeping staff. The second one is the nurse case setup, and that is where we're using a room signal to ensure that housekeeping knows when they're able to enter the room. And the third one is nurse closing case, as well as another work standard we developed. And finally, we'd just like to show you our multi-skill training checklist. This is where we'll write all of the staff's name on the list, what process we need to have training on, the target dates and current dates to ensure all of our staff are trained in the standard work.
Hi, I'm Barbara Flowers, and I work in the Kaizen Promotion Office. This week, I was a participant in this project. I'm going to talk a little bit about the 5S that we did. So on this sheet, you can see we started out with a 5S score of 1.3. What we were doing is there are 5 scrub stations in the Pasqua Hospital OR. It's called the racetrack. And the scrub stations are where surgical staff prep their hands for surgery. And what we were looking for was to achieve a score of 3.0, and Leanna's already told you that. So this is a pre-picture of the sink, and you can see that there are multiple items on there. Sometimes what we saw was that there was a replacement for every item. There were partial bottles that had been removed but not thrown away. We saw when we went around the racetrack 8 expired items, and that there was a product that wasn't actually approved. The next picture you'll see is personal items that were on the shelf. We saw those same items on a regular basis. The next one is also some personal items. The next, post 5S, that's what was it looked like when we were all done. And we posted some standard work between the mirrors. You can see there's a picture of the final product. So at a glance, if you're walking by, you can see that it looks like it's supposed to. There's also a picture of standard work. It says exactly what items are on there and where they sit. And there's a document for training. And also this is where we posted the 4 moments of hand hygiene. Post 5S, we had a score of 2.4 for a 28% improvement. And this last picture that I'm going to show you is one of the other things that we worked on was the concern around the disposal of sharps in the hallway without a lid. And also we had the disposal of some biohazards in the yellow and the white pail. Neither one was really meeting a standard. We have a plan, however, we have not implemented it yet, and so I'm not going to fill you in on that at this time.
I'm just going to touch base a little bit on the newspaper. We do have a fair number of items on our newspaper, outstanding items, but just a couple things that I want to focus in on is that it was one of the ideas is that we want to create a training video to complement the new standard work, help as a training aid. And we trialed a lot of different auditory and visual controls, and what we need to do is replicate to the other OR theaters. And again, the multi-skills training checklist to make sure everyone's trained on the new standard work.
So here you see our post-standard work combination sheet, and what you can see here is a better distribution of the work between the components. The first section is the nursing closing. The first section is the housekeeping activities. The second section is the nurse closing, and then the final section is the patient time and including the checklist to be done. What you're seeing here is a reduction in the housekeeping time to clean the room, as well as utilizing 2 to 3 housekeepers as a standard, rather than 3 to 4, which we found caused chaos. What you're seeing, though, is the changing of the combination, that the outcome of this is actually contributing to a faster lead time with higher quality. On the next slide, you'll see the post percent load chart. And again, you can see this redistribution of the workload between the 4 distinct components: nursing closing, the housekeeping of cleaning the room, nursing setup, and then the checklist. It is with this redistribution that we're looking and achieving our more timely turnover time. For our target progress report, I'd like to highlight our outcomes. First, with the inventory, we have had a reduction of 45% of items in the scrub sink space. For our lead time, we've seen a reduction from 22 minutes down to 16 minutes and 15 seconds, which is a 26% reduction. For our quality defects, with the hand hygiene standards, we've seen a reduction in the defect of 45%. We've also seen a 100% reduction in the disinfectant time not being met. That means now for every bed that is washed every single time, they have achieved their goal of 100% compliance. Again, we've seen a 67% reduction in the number of linen bags that are over 20 pounds. Our 5S score is now 2.4, a 28% improvement. Our setup time, which is from wheels out to the room is ready to receive the next patient, has been reduced by 23%. And previously we had a capacity to turn 23.6 rooms in a day shift, and we're now able to achieve 26.7 turns, a 13% improvement.
Hi, my name is Anita Gottslick. I'm a registered nurse at the Pasqua OR. I'm a participant of RPIW. I'm going to speak about the workshop summaries in a very quick manner here. Number 1, we distributed the work to reduce rework in hazardous situations. Number 2, we made clear signals to ensure quality and to pull the next step into action. Number 3, we're having a clear signal to pull housekeeping to the room and pull setup to start and pulling the patient to arrive. And number 4, we have created standard work in a more efficient sequence for all providers involved in the operating room changeover. Number 5, we have standardized one scrub sink, which will be replicated to all 5 scrub sinks. And number 6, for the patient experience, we are reducing their exposure to previous case supplies and equipment and aim for a more peaceful introduction to the operating room.
And I'd just like to thank everybody involved in this RPIW. Thank you.